Jamie Cox, head teacher, Ballasalla Primary School.
Yeah, I'm Laura, a parent of 2 primary school aged children.
Ross Keat, I'm a consultant in public health, but prior to undertaking this role I was a practising dentist for 8 years.
David Ashford MHK, Minister for the Cabinet Office.
Rosemarie, Cuskeran, Oral Health Improvement Lead.
Tell us a bit about this programme, how it came about, when it started.
So the idea behind the Smile of Mann is to ensure that at an early age children become aware of the importance of toothbrushing and oral hygiene, and to actually get it into the educational establishments and also into the homes to educate parents as well, and to also offer support to parents, some of whom may be struggling to actually be able to keep up with regular toothbrushing with their children. Because one of the things we have seen on the island for many, many years, which I never hide away from, is that we have had very high rates of children needing intervention from dentists and even teeth extractions, which we do not want to be having on the island. So the intervention of the Smile of Mann is to get that educational programme out there. And as I say, you look at other jurisdictions who have done similar schemes, it has been quite phenomenal, some of the results that have actually come back.
Is it a rolling programme or does it have a fixed time scale?
No, it is going to be a rolling programme. We want to make sure that it is carried on, that it is actually embedded as part of our culture over here on the island.
Funding, when it comes to Smile of Mann, this is central funding?
It is central funding from the Cabinet Office budget via Public Health. Like I say, the amount of work that's gone into this is absolutely phenomenal. And one of the things we do know historically and from other jurisdictions is if you get that early intervention and you actually manage to get through to the children, it's habits that stay with them as they go through life. So it doesn't just impact on the oral health of children, it also then impacts on the oral health later in life as adults as well.
Is this something that we've come to sort of quite late on? Have we been late getting on board with this?
No, I think over the years, if you look back at previous administrations, there has been attempts to try and get programmes up and running. But I think what's different this time is it has been very much a very big centralised approach. A lot of the time, the oral health strategy in previous administrations, from my point of view, has been looked at as just one component on its own. And I think what's different this time is we're joining it up in a wider public health message. And I think it's allowed it to be pushed forward. And like I say, the buy-in from the schools and also the parents as well has actually been able to move this forward a lot further than it has in the past.
So, as David mentioned there, Ross, I think the most recent survey of 5-year-olds shows that around 31% of children had some form of tooth decay, slightly higher than England and worse, it seems, than a previous survey done in 2019. Is the message getting through? Where are we going wrong?
So you've picked up on the measure of 32% of children having enamel caries. So it's important to start to break down the tooth into the 3 different bits. So you have enamel, which is the outer layer of the tooth. Beneath that, you have dentine, and beneath that, you have the pulp. So that's where the nerve for the tooth lives, and you have the blood supply, which keeps the tooth alive. When the decay is still in the enamel of the tooth, which is where we have the 32% figure, that decay is actually reversible through preventative measures such as supervised toothbrushing or fluoride varnish application. It was 26.6% of the examined 5-year-olds at the last survey who had dentine decay. Now, dentine is the second layer of the tooth, as I've said, and that is where the decay becomes irreversible, and that's where you typically need intervention from a dentist to be able to treat the decay. Again, as you said, we're slightly higher than the England average there, but this means that the Smile of Mann offers a real opportunity to embed prevention and early intervention to this cohort of children and improve oral health outcomes, which then last throughout the life course. We need to be really clear here. Oral health is a part of general health and well-being. They are not separate entities. And from a healthcare perspective, I'm really keen that we put the mouth back in the body and take oral health as seriously as we take other healthcare issues.
Rosemarie has joined us, the Oral Health Programme Coordinator. I mean, as a sort of an overview, this data we've got now, does it give us a sort of précis of our attitude towards oral health, do you think?
Yes. So I think on the island we don't take oral health very seriously. Even the fact that we still haven't got all of the schools on board, whether it's got out to the parents or whether it's stopping with the principals. So yes, I do feel that we haven't got the same outlook as other places with our oral health.
are we addressing that now with programmes like the Smile of Mann?
We are addressing it. I mean, we've got Jamie Cox with us today, who's the principal of Ballasalla. Now, the programme is for reception in year 1, but Jamie is whole school brush. So sending out the fluoride varnish consents, it's also got it on there for parents to look at so they can ask the school why they're not brushing.
And just thinking about it, you mentioned that, and Jamie is there nodding away with this one. How does it actually work in school then? I mean, practically, how does it work, Jamie, when it comes to school? Do the kids have set times where everyone goes and brushes?
As you can imagine, when the idea first come to us, we were a bit worried about how we'd run it across the school. But we have 150 pupils every day brush their teeth. Most classes, the tough paste is put onto a plate. The children will come in, get their toothpaste, and then there's usually sort of graphic, or they're watching something like News Round, or there might be a graphic or a timer, and the children all brush their teeth for 2 minutes every day, and it's pretty seamless, to be honest. It's something which has just become normal. It just fits into our school day. When we started doing it, we thought it was quite special. Now it just happens. It's really embedded into our school.
And did the kids take to it readily, or was it a case of, what on earth's going on here?
I think for some pupils in school, I don't think there was a lot of teeth brushing going on at home, and we had to help some children know how to hold the toothbrush. I think for some children, it's still the only time I'd say they brush their teeth is in school. They don't brush their teeth at home. Other children were familiar with the process, so they got straight to it. Yeah, it's not an issue at all in school.
And Laura, you're a parent of one of the kids who's taking part in these programmes. I mean, well, first off, what was your view on the programme? But did you think, great idea, or do you think, oh gosh?
Yeah, to me as a parent, I think it's absolutely wonderful to have that extra slot for them to brush their teeth. Any additional protection on their teeth, for me as a parent, is great. Our eldest, who's 9, she's been doing it for a few years now, and she loves it. The youngest, we've had problems with her brushing her teeth, but with Rosemarie and the team going in, making it fun, alongside her peers, she's come round to the idea that brushing can be fun. Don't get me wrong, we've still got the odd battle at home, but it's certainly become easier.
And is that part of it, do you think, making it fun?
Yeah, I think so, definitely. Positive messaging on how to brush your teeth, why it's important, and what can impact their teeth as well. So encouraging them to make healthy choices, that it's not just me telling them to make healthy choices, actually giving them the information so they have that, so can make that choice as well.
Was it something you learnt at school, or was it something that your parents taught
I don't
you?
remember it. It was something my parents taught me, and obviously we encourage toothbrushing at home, but to have that extra brush of teeth in the day and giving that layer of protection again, it's just great from my perspective.
And do you think you've noticed a difference with the children's teeth?
Because they brush twice a day anyway, I don't know, to be honest, because I've got nothing to compare it to. But certainly for the youngest, it's been great in terms of encouraging her to brush and brush properly, getting those hard to reach places. So for us, it's been great.
And do you think, Jamie, I mean, is it something, are you happy to sort of see it within part of the school day, or is it something you think, well, we all know school's got plenty to be getting on with in any case, and full curricular and lots to be teaching, lots to be learning by the kids? Is it something that you think, well, isn't this a parental duty, or do you think that both school and the home environment have a part to play?
I mean, it first come on our radar probably about 5 or 6 years ago. We noticed that children were absent from school because we were having to go to hospital to have extractions done. So decayed teeth suddenly we were aware of. So we've been looking at doing something for a while, and then when this scheme come ahead, it was something we wanted to get right behind. We think it's really valuable. We think it adds lifelong habits for children, and I think for the small amount of time it takes, it's literally 2 minutes every day. And we talk about fun, Laura was saying, we've got the whole class doing it together, and it's just become part of our day-to-day practice. So we're delighted to include that in part of our school offer.
So do you think we sort of slipped out of good practice then, Ross? 'Cause, I mean, I was sort of brought up, and we didn't have it in school in my day either, but I was sort of brought up, right, make sure you brush your teeth every evening, and ideally again some in the morning or sometime during the day, and get out and about. Is it the fact that we've just got sort of more fizzy sweets and goods and power drinks and things that are causing the problem, or have we got into bad habits?
I think that's a really difficult and very interesting question. And I don't think you can easily say that it is one or the other. What we can do through programmes like the Smile of Mann and fluoride varnish is the system can start to equalise opportunity for children in schools. So by ensuring that the Smile of Mann programme is running within the school, and that things that could be routine disruptors for a large number of children, for example, we're aware that children who have shared custody maybe have a more disrupted lifestyle. By embedding that into a school, we have a practical way to make the healthy choice the easy choice. And there's clearly a disconnect between what we wish happens and what is real. We're aware from the data that we gathered as part of our epidemiological survey that a lot of children are brushing on their own at a younger age, so 4 to 6, where it is more beneficial for them to be being supervised, whether that be via a teacher or a parent. And we're also aware that a large minority are not brushing consistently twice a day. So most children will say that they are brushing twice a day when they respond to that, but there is a very sizable minority which aren't brushing twice a day. So it's about trying to embed those healthier behaviours. And again, making sure the healthy choice is the easy choice is really important by utilising the system to make sure that we have equal opportunities for all.
So either this could be for you, Ross, or indeed Rosemarie. I mean, is it a fact? I mean, do kids take sort of oral health seriously? Do they not think about it like a lot of things when you're young? You think, oh, I'll be fine, it'll go on forever. Is it only when you start getting older we start to think about having a good oral health regime?
No, I wouldn't agree with that. I think children do, but the routine isn't taught early enough. So with the children at home, with their brushing, some children don't even own a toothbrush. So when we go into schools and we talk to them, we do lots of different oral health programs, and we'd say to them, what colour is your toothbrush? They just look at you because they don't know. One of the things I would say is, now when I was at school, we didn't have snacks. Going into some of the schools, and Jamie can agree with me on this, when I was in Ballasalla one day, we'd just started the programme and I could not get over what the children were bringing into school to have for a morning snack. So we discussed this, and the change now, children are bringing in fruit. So their parents, they're telling their parents, I think you were saying that about your child, that they were saying, oh, we do a sugar, how much sugar's in so many things? And then a child will say, oh, I don't want that, I'm going to have a piece of fruit instead. So I think what it is people's lives have got busier as well. Most of us, when I was a child, my mother was at home, lots of parents work today, so they take brushing to get child to nursery or to school, and 9 times out of 10 the teeth haven't been brushed. So I think it is there, but it's teaching children from a very, very early age. It's a life skill. It's like learning to read and write. So we can teach a child that at an early age. That's why we also go into early years. And then I think it follows them through. And
interestingly, David, as you were nodding there as well, it's something we've heard quite recently. I know Education Minister Daphne Kane's been keen on changing the actual sort of food at lunchtimes, and again reducing the amount of sugary goods and bringing things more, like Rosemarie was saying, things like fruit for snacks and for puddings.
Yeah, I think that's absolutely essential. It's important that we educate children and parents around the impact that some of these snacks can have, because particularly with the way marketing is now as well, the way things have been marketed, we've seen this in the press recently about the pouches for really younger children, where they might on the front of it look healthy, but when you actually delve into what's in the ingredients, it's actually not as healthy as it may first look. So it's about ensuring that children have that ability to make the choice. And I think one of the great things that's come out of the education of the Smile of Mann is exactly this. Children are making the choice themselves. Yes. And I think that's absolutely fundamentally important, because ultimately, if you haven't got the children themselves on side, then it isn't going to work. And I think what's been great about the way this programme has been rolled out is it's been very much focused on getting the kids to understand themselves the impact of the oral health and ensuring that they're fully engaged. I was saying it before about the rollout that was when I was up in my constituency with Williston. Rosemarie was there for that. And it was just brilliant to see the way the children were involved and that they were going home and saying to their parents, Luke, I need to be doing this, I need to be brushing at home as well. And, you know, Ross is right. I don't think you can actually lay it down to one particular thing and say that's what's changed over the years, because I didn't have any form of supervised toothbrushing in school either when I was in the days I was at school. But I think it's a multitude of different factors across society that's happened over the last 20, 30 years that has caused the situation where we're in now. But the great thing is it is reversible, and programmes like the Smile of Mann are the things that are going to have the impact at the different levels that will allow us to reverse that.
I suppose tricky as a parent, Laura, and that, yes, the kids are bombarded with all these adverts and pressures, and they all have phones from a fairly young age, all see it somewhere. And Lord knows, most of us like a chocolate biscuit or something from time to time. It's striking a balance, I guess, between having a treat and not, you know, having sort of chocolate and sweets every day.
Yeah, of course. Both of my children have chocolate and sweets, but we are very careful to limit that. Of course, having that brushing in there as well, it adds that layer of protection. Yeah, I won't say that they don't have them, but they are treats. We try and limit them. Ballasalla are very good at promoting healthy snacks, so we try and send our children in with vegetable sticks or fruit as their snack, and limit treats as a treat, maybe once on a Friday at the weekend. Sadly, we can't stop them eating them at parties, friends' houses, and also, as you say, it's in society. It's out there, they see it, their friends are having it, so there is that pressure as well.
And have you noticed the difference, Jamie, do you think, with the sort of snacks kids are coming to school with?
I mean, there's a lot of different pressures on parents to be able to provide snacks, so we don't want to be in a place where we're policing what parents are sending in. But as part of this project as well, we now offer free fruit every single day. So there's fruit available. If children want to have fruit, they can, and I think that's helped as well. And I think Rosemarie's been in. We're not just teeth brushing. Rosemarie's been in to see all the classes, but you're also been for parents' evening, haven't you? And set up a stand where she's been able to speak to parents as well. So it's just trying to promote that message. And I think initially, if we can work on the teeth brushing and having healthy snacks available in school, over a longer term, then we can continue to try and educate parents about choices they can make.
So we did sort of mention, basically, we're talking about oral health and the good oral health regime. Who would like to then give us an outline of what is a good oral health regime?
Good oral health regime is eating healthy, snack time. We can have treats after our meals, so 3 times a day our teeth can have an acid attack. So that's why we like to say to people to have water at school, because you're picking it up, you're putting it down. So every time you have a drink or eat something with sugar in, you're having an acid attack. That's where the problem comes in. So it's healthy eating, it's brushing twice a day or 3 times if children are lucky, because we don't have fluoride in our water here, we use 1,450 parts per million of fluoride in the toothpaste. So we teach children a pea-size amount. Brush all of your teeth, spit, do not rinse. So that's what we recommend to all children. And to visit the dentist. Now, I know that's quite difficult at the moment, but visit the dentist every 6 months or every 12 months. So that would be what we would say. Think about what you're giving your child. People give their children raisins for a snack, and raisins are not good for your teeth for a snack. So it's just thinking about everything that you do for your child and for yourself. So all of this applies to adults as well. So Ross, I don't know if there's anything else. I think that we can't really think of anything else to go in there.
It's like I said about putting the mouth back in the body.
Yes.
Having a healthy oral health routine is also going to benefit you in other ways. I know we spoke recently on the Healthy Eating podcast, which sort of touched on high fat, salt, sugar foods. Now, on the island, if you live in an area like Strand Street, you are in and we spoke about this, a food swamp. And that is an area where high fat, salt, sugar foods are extremely prevalent, which means that becomes the easy choice and the choice that people make. If you live in the north of the island potentially, and you're not close to a supermarket, we'd call that a food desert. So when you're going to the supermarket to do your big shop, you are therefore purchasing easy to consume foods with potentially longer shelf lives, lots of additives. Often that includes a lot of sugar. So it's being conscious of these decisions that you make. And the Minister touched on things around advertising. There are commercial determinants of health which go hand in hand with this, because we are constantly pushed products which are tasty because they are high in salt, fat and sugar. So there's a whole raft of things that we can do to improve people's oral health, but that is also going to have positive impacts on general health and well-being and making people healthier in general, because those choices don't exist in isolation. They're going to impact the entire body, not just the mouth.
Healthy mouth, healthy body.
Sounds good to me. And do we need any of the extras we see again? I'm thinking perhaps more of the adults watching TV or whatever. You won't watch television for very long without seeing adverts for things like mouthwashes or electric toothbrushes or maybe something like sort of floss picks. Are these all sort of useful additions, or frankly, is a good brushing regime on its own enough?
A good brushing regime on its own would generally be enough, but if you go to the dentist and you've got gum disease like gingivitis, and they would tell you to use a mouthwash, so we would recommend not for children. Children do not use mouthwashes, and it's one of the things when you go into a classroom, teachers start asking you about their own oral health and different things. So we would just say to them, if you want to use a mouthwash, that's fine, but use it before you brush your teeth or some other time in the day, so you're not rinsing the fluoride off. Floss, people should floss every day, not children, but adults should floss every day. The interdental brushes, they're excellent as well. So yes, all of those things are essential for you.
How easy is it to actually measure the success of programmes like the Smile of Mann? And do we just go on figures coming through dentists, or how does that work?
Well, Child Smile is where we have got our programme from. So they're in Scotland. They started in 2006, so they've been going for 20 years. They have improved the oral health of children in Scotland by 62%. That is very high. And Scotland would have been one of the poorest areas where they started, and they would have been their decay rate was the worst in Europe. So when you think that they've improved that by 62%, that is amazing. So we will not be able to measure that. Ross will be doing the epidemiology. We were only doing 5-year-olds. We're now going to do 5 and 12-year-olds. So we will be able to measure this 10 years time, so it should be something like that. So it's not an easy fix, but it's a start, and if the children carry on, it will improve their oral hygiene. So, and like we said earlier, it is part of a routine in your life. If we blindfolded ourselves in the morning, we'd get up and we'd all do the same thing. So if you teach a child to brush from an early age, they will carry that on throughout their adult life.
And that was a good point. I was thinking of exactly that, really, either yourself, Rosemarie, or Ross. It's a case of, do we? I mean, we're all out of the sixth form around the table here. Are we all still keeping up with good oral hygiene? Do we, rather like driving, isn't it? You learn to drive and you're really, really good. And the chances are, after 10 or 15 years, you've got into some bad habits. Does that happen the same in oral health?
Absolutely. Not for myself, certainly.
No,
not for myself, certainly. Because, we're talking a lot about children here, but, oral health is something that happens across the life course. Between the ages of 0 to 5, that's where you're really setting the trajectory for your oral health for the rest of your life. But then when you sort of reach adolescence, you get that shift where children become more autonomous and they are making their own decisions, and they may be popping out of school to go to the petrol station and they're buying sweets, or are they buying vapes or energy drinks, sugary things. So embedding these things earlier, like we've said, that's when you start making the healthier choice the easier choice, and you try to embed those ideas about healthy food and making sure that people are at least aware and knowledgeable of what good looks like and potentially what bad looks like. But then when you become an adult as well, oral health almost, or poor oral health almost becomes a silent disease because you have so many competing priorities. We don't have data for the oral health of adults on the island currently, but a recent survey was done in England, which I was part of the fieldwork team for, and there 41% had obvious dental decay during their examination. Now, this epidemiological survey is typically done every 10 years, and the oral health of adults had got better every decade from the 1960s. Now, this was the first survey where adult oral health worsened, so where there was a decrease in the amount of healthy mouths. On the island, we are our own island. We do things differently here, but I would be very surprised if we didn't see a similar change in the oral health of adults as has been experienced in England over the last decade.
And certainly, I mean, generally, I certainly think about something in my parents' generation. It was almost, I know my mum lived into her 90s and still had some of her own teeth, but it was almost an expectation that you probably would need dentures before your days were up. Whereas now, I think, well, I certainly like to think I will finish my days with what I've got in my mouth. I'm sincerely hoping I will in any case.
Well, you will have after today, because you're going to have the best oral health on the island.
It'll have to get better.
But that would have been the case years ago. People in their late 60s would have had dentures. That doesn't happen now. You could go into a nursing home and you've got people in their 80s and 90s and they have retained their own teeth. And one of those things would be also, and we will be starting this soon, is because they're being taught how to look after people if they've got MS, Parkinson's, somebody hasn't got good manual dexterity. So the staff in the nursing homes are taught how to look after somebody's oral health, which wasn't done before. So somebody would have, if they were bedridden, they would have been sitting there and nobody would have been looking after their oral hygiene. So now there's different things coming on board all the time.
So you think about who our most vulnerable groups are in society. Very young children, because they don't have autonomy and they are reliant on their parents to set the environment within which they live and the habits which they have. Okay, so you've got that cohort which we're managing through the Smile of Mann programme. I also want to see some work going on with care homes and older adults as well, because as you say, we have more adults keeping more teeth for longer, but those individuals are living for longer and they have more complex medical issues. So frailty, dry mouth, polypharmacy, so taking a lot of medications can cause a dry mouth, issues with dexterity, we've touched on dementia, care settings aren't always necessarily great for promoting oral hygiene. If you are wearing a denture, does it fit you well? So the important part for the older cohort of people is to ensure that people can function well and that they have a good quality of life associated with their oral health. We don't want any pain, any issues eating, any problems with confidence, or any increased risk of infection for that particular group of individuals. And again, I think the Smile of Mann team can be really pivotal in educating care home staff, people living in care homes, people over the age of 65, into what good looks like and reduce the burden of disease within that group.
Can you lead from the front, Jamie, when it comes to oral health?
I try my best, and with Rosemarie coming in, it did generate a lot of discussion with staff, didn't it, when you come in, and about people having Diet Coke and having different drinks. It was really useful for us as a staff as well to think about how we do our oral health as well.
Yeah. Yes. And you've been thinking about it as well, Laura, since the sort of programme, has it made you think about, oh gosh, you know what, I could probably improve my own, oral hygiene?
Yeah, certainly. As you said, lead by example. We quite often all brush as a family, just so our youngest one does brush as she should. The battle will continue, I imagine, but certainly Rosemarie and her team have made it a lot easier for us. But for the older one, she has really enjoyed the public health team coming in and explaining how much sugar is in different foods, and then being able to make the right choices there as well. Like, if I choose that, that's going to have a lot more sugar, so I'll go for something else. So certainly for our 9-year-old, that's been really beneficial as well.
And speaking of older ones, we've been concentrating chiefly on, obviously, children and educating, getting people into good habits early doors. But, do you need to change your sort of oral health routine as you get older? Because everything, we age and things tend to change. Other things we need to think about, need to do as we get older and once we've left childhood long behind.
Well, Yes, I think we do. I mean, it's like people tend to not floss when they're younger, and they can probably feel they can get away with it. When you get older, you need to be doing that. I think you get gum recession, so all of these things come into play. You might want to change your toothpaste, and the dentist might recommend that you use a toothpaste that is going to help with the gum recession, because once your gums recede, they do not come back down. So, and it's people will try and change their technique, or they'll change from a manual toothbrush to an electric toothbrush to stop different things like that happening. So I would say yes. I mean, it's like, for myself, I just feel if I was going out to do a presentation and I had got rotten teeth, I think everybody would leave the room, because they'd think, we're not going to listen to this person, because they're obviously not listening to themselves. So I do think, that you probably, as you get older, you are more conscious of staining and different things like that. So yes, I think your oral hygiene does change. Maybe I'm wrong, but I do think that.
Absolutely, and at all stages of the life course as well, a majority of dental disease, oral disease, is entirely preventable through good oral hygiene and positive lifestyle choices. So if you think tooth decay, brushing your teeth twice a day with a fluoride containing toothpaste. Gum disease, that's all about manual debridement of your teeth. So again, brushing your teeth with the fluoride containing toothpaste, that's going to have the impact that you want it to have in terms of maintaining your gum health. Oral cancers on the rise at the moment across in England, and that is due to increased HPV rates, but also linked to smoking and alcohol consumption. So HPV rates have increased in the United Kingdom, and that tends to be due to changing sexual habits. So people performing more oral sex means that HPV can be transferred to the mouth and the soft tissues of the throat, which can then lead to aggressive cancers in younger individuals. So certainly in England, we're seeing more cancers in younger people because they're HPV related. So it's being conscious of that as well. So obviously HPV vaccination, very important for individuals who are eligible to do that, because not only is it protective against cervical cancer in women, it can also be protective against head and neck cancers in both men and women. Smoking and alcohol in isolation aren't great for your oral health, but when they're combined, they're particularly bad. It's multiplicative. So if you smoke and drink, you are significantly more likely to develop an oral cancer. So if you're doing the right things, brushing, healthy lifestyle choices, you're not going to end up with any of these disease processes in your mouth.
Well, see, who would have thought I wouldn't have got that one? One thing I know in adults, sometimes people will say, well, do you think you need, do I need an electric toothbrush? Do people need an electric toothbrush? Or frankly, does it make a difference, as we're often told it is by the people who make them, or not?
Well, a manual toothbrush is very good. It is proven that an electric toothbrush is better. One of the problems that you do have with electric toothbrushes, people don't fully charge them, or they've run down and they're not going to work properly. And if you've ever, I work for Community Dental, and we used to get children to bring their brushes in, and when we took the head off, we had the shock of our lives, because the head had probably been on for a year, and what was underneath it was disgusting. So we would say to somebody, change your toothbrush every 3 months. So if people say to me, what do you think for my child? I always say use a manual until they're old enough to be able to understand the toothbrush has to be fully charged, and you have to change the head, because you can see the manual, it splays out. Once it's splayed, it's got to go in the bin. They don't see that with their electric toothbrush.
If you had absolutely perfect technique with your manual toothbrush, I would say there is no need to purchase an electric. However, none of us have absolutely perfect. No. There's I'm not going to bore you with it, but it's the modified Bass technique. Okay, you learn all about this at dental school. And if you're doing that appropriately and you're doing it quadrant by quadrant, then I would say you probably don't have to bother with an electric toothbrush. But the electric toothbrush is giving you that perfect mechanical debridement every single time. But a manual toothbrush is absolutely fine as long as you are using it diligently and appropriately, because I understand electric toothbrushes are expensive.
Yes.
So, use your manual toothbrush, use it effectively, use it diligently. But if you are fortunate enough to be able to have an electric toothbrush, it is going to make your brushing technique that little bit better.
Yeah, it's a fascinating topic, and it's something which affects all of us, all of our lives. And as you picked up on there, Rosemarie, as well, I think it's not just the point of dental caries or cancers or other problems. I think just with your teeth as well, it's, as you were mentioning, it's confidence, isn't it? I think it's as you get older, I think if your teeth are really bad, it can really affect your confidence in social situations and professional situations and all sorts.
Because the amount of older people, I mean, they could lose weight from just dieting, or they're not well, their dentures no longer fit them, and then they're talking to people and their dentures are falling down. People don't want to socialise, so then they've got to find a dentist, they've got to get things repaired for them. So I just feel that you could talk about your mouth forever. It is so important. It really, really is. It frames your whole face. And the amount of children that have time off school, parents have time off work to go to the dentist, to go and get extractions, and having a general anaesthetic. Ross can correct me if I'm wrong here, but there's 90%, 95% of children that go to Nobles is to have teeth out.
It is the most common reason for children younger than the age of 9 to have a general anaesthetic is for removal of teeth.
That is very high. I'm not sure what the waiting list is at the moment. If it's 100 children, I'm not sure. But there's a lot of children go to Nobles, and it's not to have one tooth out, it's to have quite a few teeth out.
But again, this doesn't exist in isolation, okay? So we're being very keen and hard on the prevention here, and I want to see good prevention and people not needing to have treatment in future. That's really important. But people who do need treatment and people who have reached that stage, I want there to be equitable and accessible NHS-funded dental services for people to go and attend, and I want those dental services to see people at appropriate intervals so everyone can get in. So best available evidence, we always talk about 6 monthly checkups. A 6 monthly checkup is appropriate if you have an oral health care need. For people who are completely dentally fit, there is no reason why you can't be seen every 2 years. That interval can be stretched. So I would like to see a situation where our dentists on the island are very supportive of our desire to have an equitable and accessible dental service, and they do these review appointments at an appropriate interval. Part of this as well is that we need to make sure that we completely understand the need of people on the island. So we've talked about the epidemiology of the 5-year-olds. That's happening this year. We've talked about the epidemiology of the 12-year-olds, which was recommended in our recent Children Oral Health report from last year. I would like to see that happen this year as well. We then also want to consider the oral health needs of adults. We don't have a recent island-wide clinical survey of adult oral health at the same depth as the children's programme, and that's because adults don't all go and hang out in one place for 6 hours a day. It's very easy to capture children, to not capture them. It's very easy to access children and capture the oral health of them. But as a pragmatic step, I want to use the Adult Oral Health Survey 2023 from England, which is the best available nationally representative clinical data set, to model plausible ranges of adult oral health for the island. We can then calibrate and sense check that model against what we do know locally. So service activity, access patterns, demographics. We'll obviously be transparent about any uncertainty that comes with modelling that, but it lets us plan prevention and services whilst we also develop a system where we can strengthen how we do surveillance on the island to make sure it is robust, defensible and reproducible.
It's a fascinating topic. Like I said, we could talk all day. And is there a good place if someone wanted to go to get more information on perhaps on how to brush up on their dental hygiene?
Very good.
But to look about a good, where they could find details on a good oral health regime.
Yes, on the Public Health website. We have everything on there, and if they want to speak to somebody, they can do that as well. So, I mean, it's not just for children, even though the programme is really 0 to 11, isn't it? So, because we work with health visitors as well, and we're running programmes with them. So people can contact us, and we are willing to listen and give them support. Pregnant women, we are there to support pregnant women as well. So we're very, very, very approachable.
Terrific. And if you're lucky enough to be going to Ballasalla School, you don't have to worry about it.
It is the best school, it really is, and they have the best principal.
Well, listen, Jamie and Laura, Ross, Rosemarie and David as well, thanks very much indeed for talking to us today.